I've talked about physician-assisted suicide and euthanasia, but I haven't really discussed a fundamental assumption that both of those practices make, and that's the death can be good for the person who dies. So I like to take the opportunity to talk about that today. All right, so let's take a step back. What do we mean when we say that something is good for somebody? Okay, that's the basic question. I would say that something is good for somebody if it increases their well-being, right? And something is bad for somebody if it decreases their well-being. Okay, I think that makes sense, right? All right, so the next step is to acknowledge that there are two different ways to understand well-being, right? One way is momentary well-being, and the other way is overall lifetime well-being. Okay, so your momentary well-being is exactly what it sounds like, right? It is your well-being day to day, and your overall lifetime well-being can be understood as like the sum total of all your momentary well-beings, right? So if you just have really good well-being every single day for your entire life, then your overall lifetime well-being is going to be really high, right? And vice versa. Okay. Importantly, something can be good for you or bad for you depending on what kind of well-being that we're talking about, right? So for instance, sugar, right? Eating sugar can be good for you in regards to your momentary well-being because it's pleasurable, right? But bad for you in the long term because of its negative health effects, right? Likewise, we can think of an example that is good for you, no, that's bad for you in the moment, but good for you overall, right? For example, exercise, right? Often, at least for me, exercise is painful in the moment and it's not pleasurable, right? So I would actually say that it's bad for me in the moment, but overall it's good for me, right? It's good for me in the long term because the health benefits outweigh the pain that I experience at the time. So now the next step is to think about what we care about more when we say that something is good for you, okay? I would say that what we care about more is your overall lifetime well-being. That is more important than your momentary well-being, right? That's why we say that people ought to exercise, right? Even though it's painful in the moment, right? In the long term, it's good for you. So now that we've established that, the next task is to show how death can be good for you in terms of your overall lifetime well-being, right? Okay. So if you go back to this distinction between momentary and lifetime well-being, again, you can see your lifetime well-being as constituted by the sum total of your momentary well-beings, okay? So let's say that you're having a really good day, okay? And when I ask you how good your day is, you say it's like a 10 out of 10 or something like that, okay? Or let's say that you rate it as a 10 on a scale from -10 to +10, okay? And let's say that your entire week goes equally well. That means by the end of the week, your overall well-being score is 70, right? Now let's say that next week you have like a really, really bad day, a day that you rate as -10, okay? Well, now your overall well-being score is 60, right? Because you subtract it. So what does this mean? This means that the longer a person suffers, the more a person suffers moment to moment, day to day, the lower the overall lifetime well-being score, okay? So for somebody who is in a very unfortunate circumstance where they're just going to suffer and suffer until they die, you could argue that the longer they live, the lower their overall lifetime well-being score, right? So for them, it would be good to die earlier, right? Because then their lifetime well-being score will be higher than it would be otherwise. To be clear, I'm not saying that we shouldn't discourage people from suicide, okay? In fact, I think that we should discourage the practice. But that's because I think death for most people at most times is bad for them, right? Like, I have reasonable expectations that my near future is going to go pretty well. Okay. So I think death would be bad for me right now. And I think death is probably going to be bad for me 10 years from now and 10 years after that, right? Which is why I don't want to die now, and I probably won't want to die 10 years from now. But this position is consistent with the claim that for a select few people at select times, it will be better for them to be dead. Okay. And those are the cases that are relevant when we talk about physician-assisted suicide and euthanasia, right? For these people, they can't be cured, right? And their symptoms cannot be treated. We can't treat their pain, and they're just going to get worse, right? So you could say that for them, they have negative well-being. Their day-to-day well-being is negative. I know some people are going to be skeptical of this argument, partly because we can't predict the future, right? We don't know for certain that this particular person is just going to continue to suffer. We don't know that this person won't be able to find some sort of meaning in their suffering or something like that. And that's true, right? Nobody can predict the future, including the patient themselves. But we base our decisions on reasonable expectations, right? So if you have, this type of tumor, this type of cancer, and the doctors tell you, like, look, like, we know what this is, and this is what you're looking, this is what's going to happen, then it would seem rational for a person to base a decision off of that. Because, again, right, nobody can predict the future, and yet we don't want to say that we cannot rationally make our decisions in this state of ignorance. So assuming that it can be good for someone to die earlier, then it's rational, I would say, for a person to want that. All right, it can be rational for a person to choose death, right? And the reason is this: what makes something rational is if we have good reason to do it, right? So it is rational for me to exercise because exercise is good for me, right? In the same way, for some people, unfortunately, it is rational for them to choose death because death is good for them. All right, let's think about a hypothetical scenario. Let's say you have a patient who has terminal cancer and she attempts suicide. Okay, she swallows like a bunch of opioids, and her husband finds her, and then they rush her to the hospital. The question is, given that this patient wants to die and tried to take her own life, does the doctor reverse the overdose? Does the doctor administer Narcan? Okay. And if I were consulting as a clinical ethicist, I would say that the doctor should reverse the overdose. The doctor should save the patient's life, okay? Even though we know that the patient has terminal cancer. And the reason is because if you look at the data, most people who attempt suicide don't reattempt. The data also shows that most suicide attempts are done impulsively. Most suicide attempts are done, I think, within 5 minutes of the person actually thinking about it, so they're not well thought out, they're not well planned out. So this data tells me that people actually don't want to die. Most people who attempt suicide don't actually want to die, right? So given that data, I would suggest that the doctor save the patient's life. Even though it might be true that death for this patient may be good for her, all right? It might be true, right? But we don't know that, right? So from the doctors and the hospital's perspective, they should save the patient. Anyway, those are my thoughts on the goodness of death and the rationality of choosing to die. I hope you found it interesting. I'll see you all next time.